If you clicked on this video, I'm pretty sure you are interested in skincare, or you are wanting to take care of your skin and you have this question. You may also be an esthetician and you're like, girl, I need to know the answer to this question. I am a licensed esthetician in the state of Texas. So the first question that I wanted to get into for today is the difference between AHAs and BHAs. Let's start with AHA. An AHA, the real name for it is alpha hydroxy acids, okay? Alpha hydroxy acids. This is a chemical, or a compound rather, that will go onto the skin and is going to dissolve dead skin cells. That's all an AHA is. It is a topical exfoliation, a chemical exfoliant, if you will. It is something that's going to dissolve dead skin. It's going to help with cell turnover. It can help with brightening the skin because you're getting rid of dull skin. It also can help with removing or smoothing out over time and reducing the signs of acne scarring, scars in general, any type of imperfection on top of the skin. It can help to reduce the appearance of that. So some people will use AHAs for brightening the skin, for mild hyperpigmentation issues. And some people will also use AHAs just for the practice of getting rid of dry, flaky, dehydrated skin. The important thing to remember about AHAs is this is a topical treatment. So it's going onto the skin and it's more intense than a manual scrub, but it's not going to penetrate into the actual layers of the skin. It is only going to get rid of surface level issues. And so when people tell you, oh, I use glycolic acid, which is an example of an AHA, and they're saying they use it for brightening treatments, this can happen with a high percentage over time and consistent use. But the real thing that glycolic acid does is gets rid of dead skin on top of the skin. So it gets rid of skin that's no longer needed. Like I said, it improves that cell turnover so that you're able to see the new, fresher skin. Because we have to remember, skin is a living organism. It's a living organ. It's the largest organ on the body, and so there's always something new happening. And so what you want to do is focus on getting rid of the old and bringing in the new, and that's where AHAs come in. A BHA, beta-hydroxycarboxylic acid, these are BHAs. BHAs are very similar to AHAs, but BHA goes beneath the surface. When you think of BHAs, think of going below, okay? So BHAs are going to go beneath the epidermis of the skin. BHAs are going to go beneath the first layer and clear out any imperfections that cause blackheads or whiteheads. So when people are using BHAs, the purpose of BHAs are to purify the pores from the inside out. So the reason why BHAs are so magical for so many people is because it's helping to declog what's about to come to the surface before it even gets to the surface. When you use a BHA, you can expect to purge if you have active acne, or you can expect for it to dry up any of the excess oil that is causing the acne. Now, it's not going to completely get rid of oil like, let's say, niacinamide. It's not going to do that, but it is going to clear out the bacteria and the excess oil. It's going to prevent breakouts and things like that. It's going to clear the pores from the inside out. And so this is an amazing tool, especially for the oily girls like myself. This is an amazing tool for us, and also anybody who is trying to subside any pop-ups or flare-ups of acne, okay? So this is a beautiful way to treat mild to normal acne, or even if you have, if you want to spot treat, this is also a great thing to do. If you have combination skin, you can use it on your T-zone. It's a beautiful way to calm down the overactive oil sebum production that causes whiteheads and or blackheads. Especially when we're talking about comedones and wanting to clear out the pores, especially when people are using these heavy products or these products that build up into the skin and they're not properly exfoliating, or they're only topically exfoliating, but they're not doing it from the inside out. And so, of course, when you're using a BHA, it has multiple great, amazing benefits, but the main thing that it's going to do is prevent those breakouts. It's going to help with controlling any flare-ups in that situation. It also, over time, is going to help with smoothing the texture, because when people have textured skin, not acneic skin, but textured, it basically means that they have little imperfections that are trying to bud, but it's not necessarily an acne breakout. And so you see people with like just little things, like maybe they need extractions, but maybe it's not even enough to really extract. Salicylic acid, for example, willow bark extract, for example, are perfect BHAs to incorporate into your routine. So how do you know which one to use? So we talked about AHAs being topical exfoliation that can brighten the skin over time, but essentially it's clearing out any of the dead skin. And then we talked about BHAs, which are more for purifying the skin from the inside out. Now you can go back and forth between each. That's a whole nother video where we'll talk about percentages and what you need to use or what you don't need to use within your own skin routine. But for the sake of understanding if your skin needs AHA or BHAs, you have to look at the condition that your skin is in. One size does not fit all. Your skin is constantly evolving, the seasons are constantly changing, and your hormones and what you eat have a direct play on how your skin is going to look. Ways to know if you need to use an AHA. What I like to look at is how sensitive is your skin? Is your skin on the side of flakiness? Is it dry? Is it dehydrated just because you did something and you didn't properly hydrate yourself the next day? Do you have rosacea? Do you have hyperpigmentation? Do you have any sensitivities like psoriasis, where exfoliation can be a task and a half for you? So finding the right exfoliation. Everybody's skin is different. I personally feel that the right setting of the AHA, meaning how strong is it, how concentrated is it, is going to make or break your routine. So let's just say we're talking about a normal AHA. So enzymes or glycolic acid on the lower end. So it's not going to make you peel or anything like that. It is just going to eat away at the dead skin. When we're talking about these sort of things, this is amazing for people who don't need the manual scrubbing. It's not going to help them. For people who get red easily, AHAs are beautiful. For people who have skin types that are dry and they need that exfoliation, but they don't want to flare up any existing patches that they may have, such as eczema or psoriasis, things like that. AHAs are beautiful for this because it's going to sit on the skin. It may irritate it a little bit, but it's not the same as scratching like a lot of other exfoliants do. There's a time and a place for scrubs, but for people who have more sensitive skin, but it's still dry, you need something where you can sit it on the skin and it's a lot easier to get rid of all of the excess without manually irritating those spots, right? Another way to know if your skin needs an AHA is if you're noticing that you're having peeling. So let's say that you've had a sunburn and it's been some time, or maybe your skin is just super dehydrated because you just had a baby or something like that, something hormonal. Using an AHA that's on the lower spectrum and not too heavy is a great way to get that smooth canvas without having to really go in deep. It's a great way to get rid of the dull skin so you can have that refreshed look, okay? So it's essentially your glow up mechanism. BHAs. How do you know if you need a BHA? People who benefit the most from BHAs are usually on the oily spectrum. People who benefit are those who don't necessarily have dry skin, but they have skin that's constantly producing sebum. And so you'll see that it works well for people who are on the oilier side and or people who suffer from acne. Now, depending on the severity of your skin, the sensitivity and all of these things, that's how you know how much you need, what percentage, high or low, that you need to put into your skin routine. If you are suffering from breakouts, if you have hormonal breakouts, if you have ate something and it does not agree with your skin, if you want to see your skin glow and you want it to be purified from the inside out, that's how you know you need a BHA. It's not about exfoliating. A lot of people believe that exfoliating is going to get rid of acne. That's not how you do it. It's not going to change anything. You're only messing with the acid mantle. Whole nother video. People who are suffering from acne need an inside treatment. They don't need an outside treatment. They need something from the inside to come out, right? So the salicylic acid, the willow bark extract, the papaya enzyme, these are BHAs that are going to go beneath the skin and purge and help you to get rid of, whether it's sucking it out like this, drying it up, or pushing it to the surface. So BHAs are for those who need to get rid of something inside of their skin that is ready to come out. I get this question all the time. Can you use both AHAs and BHAs? The short answer is yes. The long answer is not at the same time. So what I always tell people is if you want to use an AHA and a BHA, you can incorporate it into your routine on specific days. You don't need to overdo it. There's no reason to over exfoliate. There's never a reason to do that. In fact, you'll do more damage to the acid mantle than you actually need to, and it'll cause more problems down the line. Now, there are some masks, there are treatments for people who want to use both at the same time, and it is safe to do so. It's all about the chemistry of how concentrated and also how much your skin is able to handle. There are tons and tons of AHA, BHA products out there. You definitely can use it. The problem is you have to understand that it is exfoliating and it's also purging. So there's just a lot that goes into realizing, do you really need it, or do you just hear the word and it's a buzzword and it sounds good to you? So paying attention to your skin, adjusting your skin routine to how your skin is reacting at that moment is the most important thing. You don't want to just do something because you're used to doing it if you don't need it. So for example, you don't need to overuse a BHA if you don't really have any issues. If it started to calm down, you don't need to overdo it, because the exact same thing of a good thing can turn negative. Meaning if you use or overuse a BHA, it can dry your skin out and cause your actual organ of the skin to want to produce more oil, combating what you have worked so hard to get to. It's about that ebb and flow, learning your skin, respecting your skin, and being able to really give it what it needs at that time. And foreseeing, if you have a cycle coming up or something like that, when to incorporate these things. But you absolutely can incorporate AHAs and BHAs into your skin routine. All right, y'all, so that is all that I have on this topic. I hope that it was informative. I hope that it helped you make a decision on something that you want to purchase, or I hope that it helps you in your own skin routine at home, or if you're an esthetician and you want to help your clients more on knowing what they need and what they don't need. I hope that this gave you something to take home with you. Thank you so much for watching. I'll see you in the next one. Bye.